treatment or after their care is finished. So this is the our overall survival rates. At stage 0, 3, the chance of survival of like it's 100%. Stage 2 is 93%. Stage 4 is 22%. The proposed hypothesis that I'm presenting is implementing an affordable, personalized, evidence-based nutritional intervention for breast cancer survivals will reduce the recurrence rate and overall mortality. The importance of tailoring dietary recommendations to individual needs and lifestyle factors. What I have seen that their data available on internet or on PubMed we see is mostly for the foreign international people, like they eat red meat at a different ethnicity than us. So having a data of our region is really important when we talk about nutrition, because we have different dietary habits and different metabolism than them, and different treatment environment that we come from. The methodology of this study is it's a prospective 5-year randomized controlled trial. Participant selection is based on inclusion exclusion criteria, which is the we understand the treatment history, the stage of the cancer patient is, the treatment they are undergoing, and the willingness of the patients to participate and to adhere to the treatment or adhere to the dietary modifications provided to them. Interventions, we do a nutritional assessment and then provide a personalized dietary plan. We have dietitians in our team, and they modify the treatment, modify the plan, the chat according to the requirements of the patient. The comparison group is the breast cancer survivors who do not have specific nutritional interventions. They, after the treatment, they just come for the follow-ups and are not regularly provided a personalized dietary chart. The follow-up and data collections is done by anthropometric measurements at every follow-up visit. The statistical analysis, our final goal of the study is to know the recurrence rate and mortality at the end of the 5-year and the 10-year goal. But resulting that this study is still ongoing, I have presented the data on the different anthropometric methods that have changed with the dietary requirements. The results and discussion, the nutritional parameters changing after the personalized interventions have been weight, BMI, MUAC has no significant change, and waist circumference. The current interpretations, the independent t-test confirms statistical significance difference between the control and case groups. Weight change, BMI, and waist circumference has seen a significant change, with mid-upper arm circumference showing no change. So there are studies stating that increased number of, I think I'll go back to the last C and say that how it's the clinical implications of this data. There is a study stating that, which has been published in Nature, that says that there's increase in mortality rate when there is increase in BMI, waist circumference, and this kind of an obese patient. So if we manage this obese patients in the early survivorship care, there would be decrease in the recurrence and mortality of the patients. The future prospects is we say what we are, what we eat. And that's how tailoring a dietary plan for every individual suffering after a cancer treatment is really, within the cancer treatment is important, but after the treatment is also important, because cancer has a recurrence rate and a mortality rate higher too. Thus, thank you. You can connect with me on LinkedIn, and I'll be open for questions.
Can you show me that result table again?
Yes. I have not put all of the data here. I just like as a how I have collected the data. I need to add more to the chart. More of the chart.
So you have written only that data, no statistical analysis.
Ma'am, statistical analysis was done by one of my colleagues, and I have not done the stats by my own. So I have just added the interpretations of the stats.
So p-value is significant in?
The p-value was significant in weight and BMI and waist circumference. MUAC was not found significant. And on the basis of that, I have found one of the research which I have shared here, that says that BMI and waist circumference has a significant correlation with increase in mortality.
The mortalities till now you have not.
No, ma'am, because it's
So this is not your study, right?
no, the clinical implications of the study is not mine. I have started the study in 2023, and it's been spanned to 2028. So it's an ongoing study now.
Okay.
Thank you, ma'am. Any questions from the audience, please? Oh, sorry.
So